I'm speaking here today not only as a hospital employee, but primarily as a member of my community, asking some of the questions and relaying some of the concerns being asked of me by those in my community. Like most caregivers, I entered the field of medicine to help other people. I started out in the emergency room as a volunteer at 15 years of age. It was a very special time in my life, and what made it special was the people. Unbeknownst to me at the time, the memory of these people and those experiences would serve as a guide to what working in a hospital is all about. I saw doctors, nurses, technicians, paramedics, all working together to serve the community. There were doctors who would freely volunteer their time to do physicals for the community youth football leagues or other sports programs in the community. These are just some of the medical actions I saw that demonstrated a vested community spirit of integrity in the helping profession of healthcare. L+M is a family to me. It has a personality all of its own because of the many great people that work and volunteer their time there. Working in healthcare is extremely stressful. Hence, working together as a team forms a bond like no other, as most of you know. Let the record show that I love Lawrence and Memorial Hospital. I'm very proud of the cardiology department in which I work, its accomplishments, and yes, the lives saved in conjunction with Yale's percutaneous coronary intervention team. I consider myself a veteran L+M Hospital worker, as well as self-appointed mayor, welcoming new people, introducing them to others, and helping them find their way throughout the hospital like a lady named Roseanne Johnson did for me many years ago. I enjoy seeing these fresh new faces coming in from the local community, starting their first hospital job. What an amazing thing to see. There's nothing like seeing someone starting a journey with the hopes of making a difference somewhere in someone's life. My first manager, Irene Scheinberg, told me once that working in a hospital gets in your blood and you can't get rid of it, and she was right. There are many individuals from this local community who have started out as candy stripers, volunteers, food service workers, and have taken advantage of the continuing education programs to help them get into a professional degree program and a career in healthcare. Many of these have become managers of departments, specialty nurses, and in some cases, administrators. L+M Hospital is a great community hospital in which a career could be and can be built. I'm proud of the programs that allow this, and am proud Lawrence Memorial Hospital provides opportunities for jobs and career advancement. Community. Community is the word I wish to dwell on in my remaining moments this evening. Community is a team effort. And since it's baseball season, I'll draw an analogy of how a team effort relates to community. It's the individual efforts of the players with a team concept in mind. I'm not here to say yay or nay to the Yale L+M affiliation or acquisition, simply because I don't know all the specifics of what has been proposed. But I will express my concerns of its potential hopes of being a team player in this community. Currently, to my knowledge, there are career days where students can come to the hospital and shadow a department. We also go to schools to discuss our role in the hospital and how we make a difference with the job that we do. There is now an ongoing program of Walk with a Doc, where the community can ask health-related questions to a doctor while walking to Quantic Plains Park on Saturday mornings. Specifically, the benefits of exercise as it relates to overall health, stress, and depression. These are great things to be proud of, great things. However, over the last few years, I have seen a decrease or a restructuring in these community actions and services, and let me explain. At one time in our hospital's history, there was what was referred to as the Monday Night Nursing Series. It met on Monday nights, obviously, once a month. This nursing series was free to the public and would educate the community on certain issues. These topics could include dealing with aging parents, dealing with difficult adolescents, heart disease. These are examples of some important topics that were discussed with the community by trained nursing staff as well as medical doctors. Because the landscape of medical care is changing, which nobody denies, Doctors and nurses simply do not have the time to educate patients and family members prior to discharge. Hence, this educational program was a very important piece to our medical and societal communities. The mission of Lawrence Memorial Hospital is a good one, to improve the health of our region. But how can we help improve the health of the region without educating the region? Another community service activity was our annual Spring Stride, held the first Saturday every May. The purpose of this event was to raise money for predetermined necessities in the hospital for the community. Whether it was for items for the NICU, co-payments for rehab services, it was an opportunity for the community to see their healthcare professionals and administrators out of uniform, of scrubs, lab coat, or suit coat, and appear as just regular folk helping to meet a financial need. Money was raised by entrance fees of the participants for the stride and went to the above-mentioned services. It was also a great time for the L+M family. It was fun. In my observation that day, there were no administrators, there were no managers, there were no healthcare workers. On that one day, we all just came together as people helping to meet a need. My concerns with others in my community are this: will this affiliation or acquisition bring to the community? What will it bring to the community with regards to educating our region of healthcare issues? Will this affiliation reach out to our community through more creative ways to show our support and understanding through financial fundraising, such as the Spring Stride? Will we continue to have a presence amongst our schools to foster an interest in those who have an interest and show promise in the field of healthcare? I certainly understand there are changes in healthcare nationwide. However, we simply cannot balance these changes on the backs of our community. As a cardiology technician, a lot of my job envelops people who walk in or take public transportation from the community for EKGs, stress testing, and cardiac monitors. My concern for the community is if services are eliminated, restricted, relocated outside of walking distance, or beyond the reach of public transportation, what will happen to these folks who are in need of not only cardiac services, but other medical and educational services as well? Lawrence Memorial has a 104-year reputation of quality service, community outreach, and sometimes just doing the right thing because it is the right thing to do. Will its reputation be tarnished and its integrity impugned through this affiliation, or will this be one of the greatest shining moments in the history of L+M and the community overall? Again, I'm a proud employee of L+M Hospital. I'm honored to have been able to, and hopefully continue, to contribute a verse in its rich history, both personally and professionally. It would be a tremendous shame and waste of effort to see the foundational building blocks of Lawrence Memorial Hospital, consisting of integrity, community presence, trust, and good medical science, be crushed to a mere rubble. I want to be optimistic about the future of L+M Hospital. I would like to believe that this affiliation and acquisition could be a tremendous asset to our community. However, I, along with the community, have insufficient information to determine whether or not the community's best interests are in the forefront of this hospital, or this proposal, excuse me. One more paragraph and I'm done. I first heard this was an affiliation. Lawrence Memorial would hold on to its practices, prices, and services. Now I hear this is an acquisition. The community wants to know which it is. Because of the lack of clarity on even the basics of what this deal actually is, there is a lack of trust in the community as to what's actually being proposed. It is my anticipation in closing that this board will thoroughly investigate what the truth actually is. It is also my sincerest hope that certain safeguards are in place to make sure this community, this hospital, and the workers who make Lawrence Memorial Hospital the great place that it is are protected, treated fairly, with dignity, and with the respect that their profession deserves. Thank you for your time and attention. I know this was long. Appreciate it. Thank you.